The American Academy of Pediatrics introduced a no-pillow policy just this past year. In this video, we are going to reveal the reasons why you should not use a pillow for infants. And also, we'll discuss the safe sleep rules you must follow to avoid any kind of risk. Contrary to common belief, pillows are not a necessity for newborns and infants. It is advisable to keep your baby off pillows for the first 2 years after birth due to several reasons. Sleeping propped up on a pillow may not improve your baby's sleep. In fact, it could lead to suffocation. The soft pillow may cause your baby's delicate head to sink, increasing the chances of suffocation. Additionally, the small nostrils can get pressed by the pillow, restricting airflow when the baby moves their head. Beyond suffocation, using a pillow raises the risk of sudden infant death syndrome, SIDS in various ways. If the pillow is filled with sponge or thermocol beads, which could come loose accidentally, it may lead to choking. Traditional horseshoe pillows designed to support delicate heads could also restrict your infant's movement. Fancy infant pillows with attractive covers made of polyester or non-cotton fabrics can increase heat beneath the head, causing temperature fluctuations in the body. Excessive sweat or heat due to pillow covers may result in hyperthermia, a fatal and life-threatening condition. Most infant pillows are fluffy and not flat, potentially causing neck strain in infants sleeping for extended hours. Prolonged use of a soft pillow can contribute to flat head syndrome in infants due to constant pressure. While it's essential to lay your baby on their back to reduce its instances, using a pillow for sleep may lead to structural deformities in the head. Follow these sleep-safe rules now. Always make your baby sleep on their back, not on their chest. Avoid using pillows until the age of 2. When selecting a pillow for your toddler, ensure it is firm and flat. Change your baby's head position if it remains in one place for too long to prevent flat head syndrome. Knowing when it's time for your child to drop a nap will allow you to make informed decisions about their sleep needs. Join the conversation about finding the best nap schedule for your child's age and stage of development. Discover easy ways to help your child transition between naps smoothly, ensuring they get the rest they need for healthy growth and development. By the end of the video, you will know how this nap transition will help your baby sleep more at night. So, must watch the video till the end. As parents, one of the most precious yet perplexing aspects of caring for our little ones is understanding their sleep patterns, particularly when it comes to napping. Naps are vital for a child's growth, development, and overall well-being. However, navigating the ever-changing landscape of nap schedules can be challenging. In this comprehensive guide, we will explore the typical number of naps children take at different ages, the duration of these naps, and what to expect in terms of sleep as they grow from infancy through toddlerhood. During the first few months of life, babies spend a significant portion of their time sleeping. However, their sleep patterns are highly irregular, and they tend to nap frequently throughout the day. As newborns, babies may take anywhere from 4 to 6 naps a day, with each nap lasting anywhere from 30 minutes to 2 hours. These short naps are often unpredictable and may occur at various times of the day and night. Around the age of 3 to 4 months, babies start to develop more recognizable sleep patterns, with naps consolidating into a more structured schedule. By 6 months, most babies have typically settled into 3 to 4 naps a day, with each nap lasting around 30 minutes to 2 hours. It's important to note that every baby is unique, and some may require more or fewer naps than others. During this stage, it's common for babies to experience frequent night wakings for feedings, diaper changes, or comfort. Establishing a bedtime routine can help signal to your baby that it's time to sleep and encourage more restful nights. Infants may also experience sleep regressions, which are periods of disrupted sleep typically associated with developmental milestones or changes in routine. These regressions can temporarily disrupt nap schedules and may require patience and consistency to overcome. To learn more about it, don't forget to watch our next video. As babies approach their first birthday, their sleep patterns continue to evolve, and they begin to transition from multiple shorter naps to fewer, longer naps. By around 6 to 9 months, many babies have consolidated their naps into 2 to 3 naps a day, with each nap lasting anywhere from 1 to 2 hours. During this transition period, it's common for babies to experience some variability in their nap schedule as they adjust to longer wake periods and increased activity. Some babies may also start to resist naps or experience shorter nap durations as they become more interested in their surroundings and more mobile. It's important to establish a consistent nap routine and create a sleep-friendly environment to help facilitate longer and more restful naps. This may include keeping the room dark and quiet, using white noise machines or soothing music, and following a consistent nap time routine. By the time a child reaches toddlerhood, their nap schedule typically consists of one daytime nap, although some children may continue to take 2 naps until around 18 months to 2 years old. The duration of this nap can vary widely, ranging from 1 to 3 hours, depending on the individual child and their sleep needs. Toddlers may also experience changes in their sleep patterns as they continue to grow and develop. Some toddlers may resist naps altogether or have difficulty settling down for nap time due to increased independence and a desire to explore their environment. Dropping a nap can also lead to changes in the timing of the remaining naps. For instance, a child who previously took a late afternoon nap may now have a longer midday nap and an earlier bedtime to compensate for the lost sleep. As children transition to fewer naps and longer wake periods during the day, they may start to consolidate their nighttime sleep and sleep for longer stretches at night. This can result in more restful nights for both the child and the parents. It's important to note that every child is unique, and individual differences in sleep needs and patterns should be taken into account. While these guidelines provide a general overview of typical nap schedules at each age, it's essential to pay attention to your child's cues and adjust their nap schedule. As your little one grows, you'll see various sleep disruptions, with teething often cited as a common culprit. However, it's crucial to recognize that sleep disturbances can stem from numerous sources. Correctly identifying the underlying cause is paramount, as misinterpretation can inadvertently lead to long-term sleep issues due to the development of new sleep associations. If you're struggling to resolve your little one's sleep troubles, you're in the right place. In this video, we'll be discussing primary causes of sleep disruption, how to recognize each one, and most importantly, strategies to navigate these disruptions swiftly and restore your little one's sleep routine. Acute illnesses, including ear infections, colds, flu, can significantly disrupt your child's sleep. These conditions are often identifiable by symptoms like a runny nose, cough, altered appetite due to a sore throat, ear pulling indicative of an ear infection, or the presence of a fever. Teething is frequently blamed for sleep disturbances, yet the painful phase of teething typically lasts only a few days. Mere mouthing and drooling aren't reliable indicators of teething. If teething is indeed the culprit, you'll observe irregular wake times during sleep disruptions. However, frequent awakenings every 60 to 90 minutes, particularly in the early morning hours, suggest a different underlying issue, likely a sleep association. Additionally, watch for changes in your little one's daytime behavior, such as increased fussiness and discomfort, along with visible signs like swollen or red gums, or the emergence of a tooth below the gum line. It's essential to remain vigilant in recognizing the true cause behind your little one's sleep disruptions and respond accordingly to minimize their impact and swiftly restore restful nights for both you and your child. Another factor contributing to changes in your little one's sleep patterns is sleep regression, which typically occurs at specific ages between 3 to 5 months, during the 4-month sleep regression, 7 to 10 months, 18 months, and 2 years. However, not all children experience full sleep regressions at these stages. It's essential to recognize that sleep regressions often coincide with cognitive or developmental milestones and can last from 2 to 6 weeks. The duration of a sleep regression can vary based on factors such as the cause, the child's skills, and our response to their sleep disruptions. For instance, during the 4-month sleep regression, if your little one can fall asleep independently and link sleep cycles, the regression is likely to be shorter and less severe. Conversely, if they rely on assistance to fall asleep, the regression may persist as a long-term issue. Changes in your little one's sleep can also occur if they retain a nap that they no longer need, prompting a need to drop it. Babies typically undergo nap transitions at certain ages, gradually reducing the number of naps per day. To address these sleep disruptions effectively, consider the following strategies. Firstly, address any underlying discomfort from illness or teething by consulting with the doctor and implementing appropriate measures for relief. Ensure the sleep environment is conducive to rest by keeping the room cool, dark, and quiet. This is especially crucial during periods of learning new motor skills or transitioning between sleep cycles. If necessary, temporarily sleep in the same room as your little one to provide comfort and reassurance, maintaining consistency in their sleeping environment. Ensure your little one adheres to age-appropriate nap schedules, wake times, and total sleep duration throughout the day. Unrealistic sleep expectations can exacerbate sleep disruptions, particularly if your little one isn't tired when put to bed due to illness, teething, or learning a new motor skill. In such cases, they may struggle to fall asleep or may use the time to practice the new skill, leading to frequent awakenings and a reliance on parental intervention to return to sleep. To address these issues effectively, maintain age-appropriate sleep times. Ensure your little one follows age-appropriate nap schedules, wake times, and total sleep duration. Consistent bedtime routine. Maintain consistency in your bedtime and nap routines to provide familiarity and cues for sleep. If your little one previously fell asleep independently, continue using the same routine to give them the opportunity to self-soothe. Address night wakings. If your little one wakes up at night, assess whether it's a usual feed time. If not, wait briefly before intervening, providing comfort as needed without immediately resorting to feeding to avoid creating sleep associations. By addressing underlying causes, maintaining consistency in routines, and responding appropriately to nighttime awakenings, you can help your little one navigate sleep disruptions and return to restful nights. Don't forget to watch the sleep guide video for additional support, and stay tuned for more parenting tips and tricks. If you found this information helpful, give us a thumbs up. Your likes help other parents find this helpful content. Thanks for watching. Until next time, happy parenting.